Hey, Rebecca, great to meet you. How you doing?
I'm great, Amy. Thank you so much for having me here today. I am really thrilled to be able to talk to you.
Oh, good. Well, UCB has been a great partner of the Child Neurology Foundation for a number of years now. And so we just get to have a couple minutes of fun where we get to just chit chat about how much we've done together in the last couple of years and about our relationship.
That sounds awesome.
So just to get us started, why don't you tell us a little bit about yourself and your role at UCB?
Sure. I am based here in Atlanta, Georgia, at the UCB office in Atlanta, working from home right now. But from a historical standpoint, I'm actually from Atlanta, and I grew up here and have been here almost my whole life. I have background-wise PharmD and PhD, which I got here in Atlanta from Mercer University, actually. And through my education, what I really found out was that I loved science, and I loved the fact that we could impact patients on a really personal level with medications. And so that eventually pushed me towards working in the pharmaceutical industry. And about a year and a half ago, I got the opportunity to join UCB. And what really drew me to the company was the focus on science and the focus on patients, because like I just mentioned, that's really where my passion lies as well. So there was a wonderful alignment of my own personal values and the company's values as well. So as I've joined UCB, the great thing that I've learned is that not only is that a tagline that's used at UCB, but it's also something that people live day in and day out. Every day that I'm at work, I hear about the impact of patients and how important patients are to UCB. So it's definitely more than a tagline. It is truly a value that's lived. From the standpoint of my specific role here at UCB, as the medical strategy lead for epilepsy, my role is to work with my team to make sure that we're equipped to mitigate any data and educational gaps. One of the things that we do is gain a lot of feedback from clinicians, from patients, from advocacy groups like yourself, and then take that back to integrate into our strategic paradigm to make sure that we're really meeting the needs of the most patients that we can.
Yeah, I didn't even know that your position existed until recently, but I could really see it on our side. So the first person I ever met from UCB was Christy Lingle. And this was like years and years ago. And she brought me in the very first meeting I had, and it was a huge table filled with UCB. I was very, very intimidated. I was there by myself. And I was like, oh my gosh, what are they going to talk to me about? And you have the coolest titles at UCB. Everyone's title is very, very sassy and cool. And every person though went around and instead of just kind of talking into the ether, every single person talked about how their role related to their strategy. So I've actually always identified UCB as one of our CAB partners that you like to really think about strategy and how to translate that down into the ways that we engage with each other. So you're doing a great job and you're obviously at the right place.
That's great to hear that that's kind of been something that has been continuing. And it was obvious when I joined that was the case. The other interesting thing that I noticed when I interviewed and then after I joined was how many folks have been at UCB for years, really long periods of time, 20 plus years. I mean, we have people that are here 20 years, 30 years, 15 years, 10 years, and that's not necessarily something that you see at a pharma company all the time. And that from the standpoint of having people really understand and relate to the vision of the company and relate to the connection to patients that UCB desires to have, I think that speaks volumes. And so it doesn't surprise me now, but I think that in the beginning, if I'd heard that a year and a half ago, almost 2 years ago now, when I was joining the company, it would have been another draw to be at UCB.
Oh, for sure. Yeah, you want to work with people that like what they do.
Definitely.
What are some other things that you think makes UCB unique in the neurology space?
If we think about UCB in the neurology space and epilepsy, obviously at UCB we have two main areas of study. One is immunology and one is neurology. And in neurology, one of our big focuses, and our big focus really, if we were to take a step back and look, is epilepsy. We have a history of working in epilepsy, and it's something that we are ingrained in from a historical perspective and will continue to be ingrained in from a future-looking perspective. In the neurology space and from a patient standpoint, what we're really focused on is making sure that we meet those with the most unmet needs. So we're continually looking for what we can do to potentially meet those unmet needs. And one of the things that stands out about children and treating children with epilepsy is that they do have unique needs. And so from that standpoint, we have to think about them a little bit differently. Many times with kids, their treatment plan really involves their whole family and involves multiple caretakers, involves school, involves so many factors that may include teachers or administrators at their schools. So many factors come into play here. And so managing medication therapy and managing epilepsy with these patients and controlling seizures in kids, just really from what I see and understand, is that it just really involves a holistic thought process and involves a lot of places where there may be special needs that we need to address or different accommodations for these patients. So I think it's a really interesting paradigm to think about how UCB can use the values that we have and our commitment to patients and our commitment towards looking towards meeting unmet needs, and really use that in the child neurology space.
Yeah, so, I'm trained in pediatrics. One of the foundational things that they just absolutely clobber you with in your training is that to treat a child, you treat the family. It's all about family-centered care. So that's completely true. And I would say, now with UCB, we have this fabulous liaison with y'all, Laura Falcon, and she's been here for a little bit over the year working with us. And I can tell from her previous role with UCB when she was really more engaged with the clinicians and hearing their daily needs and sometimes struggle of how to best support families that are living with a child living with epilepsy. She gets that. She translates that very well into our strategic conversations. And I think it's really shown by some of the partnerships that UCB has engaged with the foundation on, including transitions of care, including our educational series, including peer support, how we really help support that family. So it's good to see the translation down to like the day-to-day practice that we do with UCB. Let's talk a little bit about, because you are a huge player in the epilepsy space, you have invitations to join different sorts of corporate alliances or corporate advisory boards, and you've been a longstanding member of the foundation's corporate advisory board. Can you tell us a little bit about why UCB continues to join our CAB?
Absolutely. So I think that one of the things that I'd highlight is that the commitment that's shown by the Child Neurology Foundation Board of Directors towards inclusiveness, diversity, and inequities in the child neurology community really is inspiring. And it aligns very closely to our company vision and our company focus as well. The other piece of that is that CNF is such a recognized and trusted member of the child neurology landscape. And the experience that you guys have with convening stakeholder leaders in conversations and responding to urgent needs with really decisive actions that are demonstrated by the activities that you guys have done, even an example being through the COVID pandemic scenario, making sure that there were educational initiatives available for clinicians and for families as needed. So I think that from that standpoint, making sure to take action on the things that we're passionate about, and then measuring the outcomes is a key piece of that.
Well, thanks. It's always nice to hear feedback, positive and directly to your face. So I appreciate that very much. We try to really always act not out of want, but out of need. And last year was just fraught with so much need that COVID illuminated for us, that we were we felt really honored and humbled to be able to respond. And UCB, you joined right in there. You were part of our Rising Tide initiative, and we're so grateful for that. We've done a lot together over the years. Do you have a favorite project that we've worked on?
You know, if I was going to highlight one, I think that talking about the Chica project with Child Neurology is really interesting. So as I came to learn more about it, the decision support system being really a technologically focused, innovative approach that can improve communication is really key, because we know that breakdown of communication is a key reason why some of these things don't happen properly, and sometimes where misses happen. So I think that seeing an innovative way of moving that forward is really exciting, and also again goes back to our values as well and our excitement about innovation towards the future.
Yeah, it was great. I mean, it wasn't a long conversation that we had when we were talking about the Chica program that UCB said, let's jump on in and help us cross the finish line in building that decision support system. And that's always kind of been in the response of UCB. So I even remember a very pointed conversation in 2019 around behavioral management. And of course, this was before COVID, before we knew the realities of COVID, but we were really hearing and receiving a lot of data from the community, especially within the autism and epilepsy community, about the desperate need from both caregivers and professionals to have some more training on how do we help manage the behavior of these children and youth, extreme agitation, anxiety. And it, again, wasn't very long of a conversation where I was bringing this data towards UCB that immediately, I mean, it was on the spot that you all said, how can we help? And that led to a whole initiative on behavioral management that we launched in 2019, not knowing what a huge epidemic in of itself it was going to be during COVID, with these children and youth losing services, being more isolated, families really struggling with how to help control and manage these behaviors. So you all are very consistent in hearing need and then being decisive in your action to join us in executing solutions towards it. So we really appreciate that.
Oh, thank you for that. I'm really just thrilled that we're in a position to do so. And I think that one thing that you mentioned that I'll highlight is the listening part of that. I think that any partner, I think that's another key thing you mentioned earlier, asked about earlier, is why we continue to work together. And I think that part of it is the listening part of it. I think that having the opportunity to work alongside you guys and to really listen to what the needs are of the community, we rely on strong relationships with groups like Child Neurology Foundation to make sure that we are listening to the right folks at the right time and staying up to date. It's so hard to keep abreast of all of the happenings in the world in general, but even in what sometimes people think of as a smaller space like epilepsy, just one disease, and the whole myriad of complications that we can experience in life, it's still a challenge to stay up to date. And so we value partnerships with folks like the Child Neurology Foundation so that we can be an active listener and then take that back for hopefully some actionable insights.
Well, and vice versa. I mean, I think that's why the foundation loves to convene multi-stakeholders, because you can't just look at complex issues from your siloed perspective and think you understand it fully. And so another reason why we love our CAB is, our board was like, we've got to develop a forum where we can really engage with our industry partners to understand their perspectives. I mean, you all are the ones that are bringing forth these innovations that we want our children and families to access. So we have to understand where you're coming from and what barriers you're facing or gaps in understanding. And so we too like to listen and appreciate when we can really have that balanced partnership and get into like the dirt of talking about issues. So is there anything else that you kind of want to add from the UCB's perspective?
I don't think so. It's been just a real pleasure to be able to talk to you today and connect virtually. So it is.
I know, hopefully someday in person, right?
Absolutely. I'm looking forward to it, but it's been a real pleasure to be able to talk today.
Same here. Thanks so much. See you soon.